Good afternoon, students. Today we are going to talk about thanatology, and the issues we will discuss today are the following. General aspects of forensic thanatology, process of dying and death, clinical and biological death, their diagnosing, early and late body changes, diagnosis of the time of death occurrence, examination of the corpse on the scene of its detection, and role of forensic expert during the examination of the corpse on the place of its detection. As we know, the final stage of individual existence of a body is its death. The issue of dying and death is studied by such a branch of medical science as thanatology, from Greek thanatos, death, and logos, study. Thanatology is a scientific study of the process of dying in a body, from the initial manifestations to the complete decomposition of the corpse. In case of forensic medical examination of a dead body, it is always required to determine not only the cause and genesis of death, but also find answers to some specific questions. For example, determine the time of death, the pace of dying, the position of the body after death, and any changes thereof. Forensic medical thanatology is occupied with solving for this and other questions. Thanatology can be categorized as general and special. General thanatology studies the diagnosis of death, the dynamics of its development, postmortem changes, and their dependence on environmental factors, peculiarities of dead body examination, with view of determining the cause of death, and the means of artificial conservation. Special thanatology studies the same issues, but in case of death caused by various diseases, as well as different causes and kinds of death. For example, in deaths which occur after mechanical asphyxia, after trauma by blunt subjects, and after trauma by sharp subjects. When dying, the human body is in the so-called terminal state that is characterized by progressive decline of the functions of the central nervous system, respiratory system, and blood circulation organs. The terminal state can be roughly divided into several stages: pre-agonic, terminal pause, agony, clinical death, and biological death. At the pre-agonic stage, blood pressure decreases gradually. Consciousness and electrical activity of brain get depressed, and truncal reflexes are restored. Then the terminal pause follows, during which breath is temporarily stopped and bradycardia is replaced by periodic asystole. Agony is characterized by stopping of breath and heart-beating activity with simultaneous termination of cerebral cortex function. The agonic increase of life activity is quickly followed by the clinical death that lasts for 5 to 7 minutes. It is characterized by the profound depression of the central nervous system, stopping of blood circulation and breathing. Clinical death is the reversible stage of dying. For this reason, timely provision of medical aid for a person in this condition can bring her back to life. The following signs can prove clinical death: absent functioning of the vital organs, such as heart, lungs, and brain. The signs of clinical death of a victim are witnessed most often when examining a place of the accident. Medical aid must be provided either till the vital functions of the body repair are restored, or postmortem lividity emerges, thus proving the death coming. Clinical death is followed by biological death. If death came quickly, the forensic medical examination of people who have died rapidly without agony shows liquid blood in the heart and vessels due to fibrinolysis. In addition to that, in case of quick dying, such signs can be found during examination of the dead body as blue face, conjunctiva ecchymosis, obvious postmortem lividity, urine or feces output, pink mucus in respiratory passages, significant congestion of visceral organs, right half of the heart overfilled with blood, minutely dotted hemorrhages on the surface of lungs, target spots, as well as in visceral, pericardium, and sometimes in other organs. The set of these signs is called the signs of quick death. If death is preceded by agony, dense clouds of blood can be found in the heart and vessels. Criteria for determining of cerebral death. Absence of consciousness, attonia of muscles, absence of pain, absence of light sensitivity, absence of some reflexes, absence of independent breathing, and cessation of brain circulation. Reasoning behind the cadaver forensic examination. At first is violent death, suspected violent death, sudden death, detecting the body of an unknown person or a dismembered body. Death the cause of which has not been established by doctors. Death in ambulance during transportation. Death in hospital with undetermined diagnosis. As for forensic medical classification of death. From the biological point of view, natural and unnatural deaths can be distinguished. Natural or physiological death comes when physiological capabilities of the body are exhausted. For example, at extreme old age, significant premature births, or in case of fatal congenital abnormalities of a newborn. Unnatural death is caused by a disease or injury produced by environmental factors. Forensic medical classification of death includes category, kind, and manner of death. Having examined a dead body, the forensic medical expert must determine the category and kind of death. According to the category, death can be violent or non-violent. Violent death is caused by external factors of different origin. Non-violent death has only internal causes. It is illnesses. Kind of death can be determined either by external factors or illness that caused it. By its manner, violent death can be a homicide, suicide, or accident. These notions are not medical, and for this reason, the type of death must be determined by investigation or court. In individual cases, a forensic medical expert can find out the signs proving that the person acted with her own hands. Non-violent death, by its manner, can include sudden, unexpected death, whose cause remained unknown until autopsy, and death caused by some diseases diagnosed during lifetime. Life of the body is provided first of all by the functioning of blood circulation, respiratory, and nervous system organs. By determining the signs of heart, lungs, and brain functioning, it is possible to state that a person is alive. For example, functioning of the nervous system can be confirmed by the presence of consciousness and reflexes. Functioning of respiratory organs is confirmed with the help of phonoendoscopy by breath sounds and breathing movements of chest. Cardiac activity can be proven by the presence of cardiac impulse and pulse. Absent signs of these systems functioning can mean only probable biological death, because they are the same as the signs of clinical death. After clinical death, certain changes develop gradually in the body, allowing reliable confirmation of the fact of death, and for this reason they are called absolute signs of death. They are divided into two groups: early and late signs of biological death. Early absolute signs of death include postmortem lividity, rigor mortis, albor mortis, dryness of certain skin areas, and autolysis. In addition to that, the white papillary effect is of great expert importance. This symptom can be found out by eye compression when the round pupil becomes oval. These symptoms appear at 10 to 15 minutes after death. Postmortem lividity or livor mortis. After cardiac arrest, blood stops moving in the vessels and, according to the gravity law, it gets accumulated in the lowest part of the body. If the dead body lies on the back, these spots appear on the posterior surfaces. If the corpse is situated pronate, they emerge on the face and frontal surface of the body. In case of hanging, postmortem lividity appears on the extremities. Postmortem lividity starts 30 minutes after blood circulation has stopped. The period of lividity occurring depends on the mechanism of death. If it was caused by asphyxia or cardiovascular diseases or electrical shock, postmortem lividity begins rather quickly. If death was caused by the loss of blood, it develops slowly. Postmortem lividity appears only on those parts of the body that don't get in contact with the surface where the body is situated. There are three stages in the development of postmortem lividity. First, hypostasis. Second, stasis. And the last one, third stage, is imbibition. Hypostasis is characterized by the movement of blood through the vessels and lasts from 2 to 12 hours after the onset of death. When you click on a cadaveric stain at this stage, it completely changes its color, pales. Hypostases have the following phases. The first phase lasts up to 6 hours. Death spot restores its color in 1 to 2 minutes. The second phase, which lasts from 6 to 12 hours, death spot restores its color in 3–5 minutes. At change of position of a body of a corpse, in a stage hypostasis cadaveric, a stain move on a new underlying sides of a body. Stasis is characterized by the constant release of plasma into the perivascular space and blood clotting and lasts from 12 to 48 hours after the onset of death. When you press on a death spot on this stage, it partially changes its color, partly paler. Stages of stasis. The first phase lasts from 12 to 24 hours. The death spot restores its coloration after 15–30 minutes. The second phase, which lasts from 24 to 48 hours, the death spot restores its coloration to 1 hour. Imbibition, characterized by hemolysis of erythrocytes, diffusion of hemoglobin into the vessel wall, leaving it beyond and impregnation of the surrounding tissue and lasting more than 48 hours after the onset of death. When you press on a death spot at this stage, it does not change its color. When you change the position of the body at this stage, the movement of death spots is not observed. Usually, postmortem lividity can be of different shades of blue or purple. However, if the death was caused by carbon monoxide poisoning, these spots are of bright red color due to carboxyhemoglobin. Grayish-blue lividity is found in case of poisoning with methemoglobin formers. If low temperature or humidity produces its effect, postmortem lividity becomes pinkish red. Sometimes a color of postmortem spots may indicate the cause of death. In some cases, it is difficult to distinguish bruises and postmortem lividity because they can be of a similar color. But bruises have clear contours. They are situated on the site affected by an obvious object. Some swelling of tissues can also be present. The tissues don't change their color after measured pressing. And when the skin is cut, a clot of blood appears that is tightly connected with the adjoining tissue. In this photo, we can see a bruise, which is purple greenish and yellowish color, and it has a clear contour. Medico-legal importance of livor mortis is the following. It is an absolute sign of death. The changes after the death help in estimating the time of death. It indicates the posture of the body at the time of death. It may indicate the moving of the body to another position sometime after death, and sometimes its color may indicate the cause of death. Body drying. Several hours after the death, humidity evaporates gradually from the body surface and the process of body drying begins. First of all, it becomes obvious on eye sclera and mucous surfaces on injured sites. The surface of such areas becomes dense and brown, this resembling the injuries. These areas are called parchment skin. If the eyes of the dead body were opened for 5 to 6 hours after death and the environmental conditions promoted humidity evaporation, brown and yellow areas of postmortem drying, for example, larger spots, appear of sclera. As for temperature decrease or algor mortis, its termination of the process of heat exchange in a dead body leads to its cooling under the influence of a lower ambient temperature. There are measuring of rectal temperature and deep inner organs, for example, liver, which are used in forensic medicine. The body of a live person has a certain temperature. After death, heat production stops and the temperature goes down slowly. At room temperature, the dead body becomes cooler by 1 degree per hour within the first 6 hours on average. After that, the cooling speed decreases and equals to 1 degree every 1.5 to 2 hours postmortem. If the ambient temperature is 16-20 degrees, the body is completely cooled 24 to 36 hours after death. That body temperature of 20-25 degrees is probative sign of death. Temperature in body cavities or visceral organs changes slowly, and as a consequence, it can be measured to determine the time of death. The process of algor mortis is studied in 2 stages. At first in a palpatory way, then with the help of thermometers. Medico-legal importance of cooling of the body are, at first, it's an absolute sign of death. It helps in estimation of time of death. It helps in estimation of the cause of death. The next early signs of biological death is postmortem rigidity or rigor mortis. After death, all muscles are relaxed. Initial relaxation. However, steadily they become stiff and the stage of rigor mortis begins. The earliest signs of rigor mortis can be detected 2 to 4 hours after death in mastication muscles. Then the muscles of neck, torso, arms, and legs follow. By the end of the first day after death, rigor mortis is the most intense and present in all muscles. This condition of muscles remains for 1 to 2 days more. Thereafter, on the 3rd or 4th days after death, rigor mortis disappears, gradually in the same order. Secondary muscle relaxation. Medical-legal importance of rigor mortis is, at first, it is an absolute sign of biological death. The dynamics of appearance helps in estimating the time and cause of death. It indicates the position of the body at the time of death. Cadaver autolysis. Cadaver autolysis is a process of cell digestion of tissues caused by the action of proteolytic enzymes without the participation of microorganisms. The internal organs under the action of enzymes are impregnated with blood plasma till it comes red. Firstly, its signs appear on the surface of stomach, pancreas, intestines, and in adrenal glands. As for medical-legal importance of autolysis, autolysis has negative value, simulating ante-mortem pathological processes. Late absolute signs of death mean cadaveric changes that alter the appearance of the dead body and usually appear after the second or third day after death. They are divided into destroying and conserving ones. The destroying changes include decomposition and body damage by insects and animals. The conserving changes include adipocere or saponification, mummification, heat tanning, artificial conservation, and the preservation of the dead body in special media, cold, salty, or other solutions. Corpse decomposition is a complex microbiological process with microorganisms participation, which leads to decomposition occurrence of organic nitrogenous, mainly protein-like substances. The first signs of decay are manifested on the second, third day when the skin in the iliac region becomes dirty green in color. This process usually first happens on the abdominal wall, where its color becomes green by the first 24 hours. Further, the superficial veins become outlined in green coating, so-called marbled appearance. The body begins to swell with gas formation in tissues with progressive bloating. The skin becomes blistered as epidermis separates and peels off, with large bullae. Bloody fluid is squeezed up from opening of body. There is specific smell. Gradually, all tissues become liquid and skeletonization appears. Damage to the corpse by insects and animals. Flies lay eggs in the opening of the nose, mouth, in the eye slits, in the opening of the ears. After 24-48 hours, the larvae emerge from the eggs. After a week, the larvae turn into pupae, and after 2 weeks, flies fly out of the pupae. The entire life cycle of flies takes around 3 weeks. If the dead body is in the forest or in an open place, in a room or water, it can be damaged or destroyed by wild animals, birds, or pets. The injuries caused by animals and birds can look like injuries caused by some piercing or cutting objects. However, histological examination never shows any signs of an intravitam reaction to the injury. Adipocere is saponification of the corpse resulting in the fat is broken down into glycerol and fatty acids. For example, oleic, palmitic, or stearic. Saponification occurs if the body after death is positioned in damp surrounding without oxygen for at least 2 months and more. Body in a state of saponification, it looks like a grainy mass, grayish-white, which resembles a mixture of fat with sebaceous wax, the brilliance and characteristic smell of rancid cheese. Mummification. Partial or complete dehydration of the corpse, resulting in the tissue of the corpse losing moisture, gradually exposed to drying, wrinkle, become dark brown in color, and become dense. Mummification occurs if the body after the death is positioned in a hot, well-ventilated and dry surroundings. It depends on the temperature climate. Adult body mummification under favorable conditions can occur no earlier than 6–12 months, and in children's corpse it takes less time. Pit tanning is a kind of dehydration that occurs in the corpse when it enters the pit swamps and soil that contain humic acids while the skin of the corpse becomes darker. Internal organs and muscles become smaller in volume. Bones become elastic and soft. As for medico-legal importance of late signs of death. Medico-legal importance of putrefaction. Putrefaction leads to skeletization of body and all individual signs of all injuries disappear. Medico-legal importance of saponification. When the process involves the face, the features are well preserved, what helps to establish the identity. Because of death can be determined, because injuries are recognized. The time since death can be estimated, and it indicates the place, water or moist ground from which the body has been taken. Medico-legal importance of mummification. It is the same as that of adipocere, and it also indicates the place, hot, dry area from which the body has been taken. Now we are going to talk about forensic medical examination of a corpse on the scene of death. The site or place of an incident is a territory or premises where not only the evidence of crime is found, but the case of suicide or an accident causing death. According to the current legislation on site inspection, to the first urgent investigatory action of a great importance. Inspection of a scene of incident and corpse is stipulated by the articles of the Criminal Procedural Code of Ukraine. There are three main methods of on-site inspection of the incident concerning the methods of its making: concentric, eccentric, and frontal. Concentric method begins from the periphery to the center. The main objects of investigation, a cadaver. Eccentric method begins from the center to the periphery. Its advantage is in the fact that having examined the main site, the body and injuries on it, the investigator already knows what should be found and draw attention to. And frontal method, or linear, includes a linear examination of the place from one border, which is considered to be the initial ones, to the opposite one. The process of inspection of the scene of event is divided into two stages, static and dynamic. The static stage, the position and pose of the deceased outer garments, their general conditions, and all the objects found around are inspected. All the elements of the scene cannot be moved. Investigation photos are taken. The dynamic stage. It follows the static stage and is more detailed description of the general data about the body. The objects at the scene of death can be removed and replaced. The cadaveric phenomena and morphological appearances of the external injuries are fixed. Postmortem interval is calculated and biological evidences are reviewed. The specialist in the field of forensic medicine composes the medical part of the document, which is called the protocol of examination of a scene. The procedure of the inspection of the body on the scene of death. At the scene of death, forensic expert or doctor described the dead body according to the following order. At first, the description of a place where a dead body is found, fixing of its position in relations to immobile surroundings objects, to make notes of general information about the decedent, sex, age, length, constitution, skin, presence of tattoo, scars, etc. The position and pose of a deceased. Description of the clothes, outer and underlined, and shoes. Investigation of signs of death, at first early, then late. Estimation of the age of death. If it's possible, some supravital reactions are checked. Description of the injuries seen on open parts of the corpse, their location, properties, shapes, features of the edges and ends, walls of the wounds and their bottoms, surrounding tissues, etc. For the establishment of the used traumatic instruments. And last one is examination of deathbed. Deathbed is the surface on which the decedent was found. And you must remember one important rule. A doctor of any specialty can be involved into forensic medicine examination of a corpse on the scene of death. Every medical specialist has to know signs of death, procedure of forensic medical examination of a corpse on the scene, to carry out forensic medical investigation of corpse, to determine cause of non-violent death in case of sudden cardiac death, and write out the medical death certificate. Thank you for your attention.